And now we move to our next speaker for this episode, Sercan Arık, a research scientist at Google Cloud AI. Serkan is an artificial intelligence researcher focusing on bringing AI to the most impactful use cases in the world. He will be talking about AI-Augmented Epidemiology for COVID-19.
Hello, everyone. My name is Sercan Arık. I'm a research scientist from Google Cloud AI. Today, I'll present you our work, AI-Augmented Epidemiology for COVID-19. Why we started this project? As you all know, COVID-19 has had significant impact on many organizations and society. Accurately predicting the future of COVID-19 can help healthcare organizations, public policymakers, manufacturers, businesses, and also general populace. We believe that we could bring unique benefits given our expertise in machine learning field. We launched our COVID-19 prediction models to general public in August 2020 in the US and November 2020 in Japan. Our forecasts have been running daily since then. It has been used by many organizations both in the US and Japan from healthcare, public sector, and retail manufacturing industries. The traditional epidemiology is based on these compartmental models, which are basically modeling groups of people who have the same characteristics for the disease, and they use these simple differential equations to model the relationships between them. These traditional models have many disadvantages. They cannot model non-stationary dynamics, they cannot take advantage of the vast amount of data available, and eventually they cannot give good accuracy. The way we look at improving compartmental models is that we know there is a lot of data available with significant amount of informative signals. So can we take advantage of them by integrating them into compartmental models? And here are some examples. For disease spreading, the data related to mobility or interventions like school closures can be very important. Or for death rates, the data related to healthcare supply or the population demographics can be very important. So our goal was to bring these data sets into compartmental modeling and eventually provide very accurate disease modeling that can be useful for COVID-19 decision makers. We propose time-varying functions that are machine learnable to improve compartmental modeling by integrating them into the transition rates between the compartments. Besides this simple idea, we have introduced many technical innovations to push the state of the art in disease modeling. Here is a list of our technical innovations that I will not go into details, but just to recap, we propose learned transition rates. So instead of using static rates, we have the time varying machine learning functions that map these variables into time varying rates. And this allows us to take advantage of different data sets that we integrated, including mobility, healthcare supply, demographics, econometrics, and so on. We design our machine learnable mapping functions in a way that they are inherently explainable, so that our framework not only gives accurate forecasts, but also provides explainable insights on the disease dynamics. And these explainable insights are important for users to build trust into our model and also get additional information that can be useful for COVID-19 understanding. Then we expanded the standard compartmental model with hospitalization, ICU, and ventilator compartments. And more recently, we have also added vaccine compartment as it's very important to model vaccinations. And these expanded compartments also allow decision makers to predict hospitalizations or the amount of ventilators needed. We have integrated the concept of information sharing across locations, and this allows us the capability of doing very fine-grained modeling. So for the US, for example, we do county level modeling, and there are more than 3,000 counties in the US. And this single model that is used for all these counties is very important to both aggregate the information from many counties. And also, this information sharing can be helpful in mitigating the noisy and missing data that exists at some locations. And lastly, we have brought innovations for sequence-to-sequence modeling. So this is inherently a multi-horizon forecasting problem that is very difficult because of the error propagation effects, in a way that we are predicting many days into the future, and small amounts of errors inside systems can grow a lot towards the future. And we brought some novel mechanisms in machine learning training to minimize these effects. Here is the overall framework that we brought. So we have machine learnable compartmental model, and it gives future predictions, explainable insights, and counterfactual simulation capabilities for decision makers to change key input variables and observe their effects. We have developed our model for US and Japan, as I mentioned, and we have partitioned the timeline for model development as well as prospective evaluation before deployment. So you can see our timelines here that we had more than 2 months for prospective evaluations to get statistically significant performance metrics on our proposed models. And the performance of our models are presented here. So during this prospective evaluation period, we have demonstrated that our models can achieve very low amount of error both in the US and Japan. And this low error has been consistent throughout the entire evaluation periods. And this is even during the periods of considerable change in population behavior, such as new peaks or trend changes due to some policies and so on. And our models are robust to demographic differences across different geographic locations. So we have observed consistently high accuracy for different counties in the US or different prefectures in Japan. We compared our model to some of the alternatives out there, and here are many of the models proposed for the US, and we have demonstrated that our models outperform all other models except one, which is the ensemble one that also includes our model. I would like to also talk about the explainable insights, the important capability our framework gives. One of the important explainable insight capability is assessing interventions. So here is an example that we demonstrate for two locations, Texas in the US and Aichi in Japan. So we observe that for these two locations in this period of evaluation, there are significant intervention policy changes, and these include changes in the mask mandates as well as mobility restrictions. And our model can take these into account accurately. And here we show the impact of these policy changes. So relaxing the interventions basically causes the spreading rate to go up, and it shows up as increase in the confirmed cases in some with some lag amount. And this gives the users the capability of understanding which interventions are the ones that are the most associated with the case increases, and also giving strong insights on what to change so that they can try with counterfactual simulations before optimizing policies. Another explainable insight capability is getting ideas on which features are the most important ones. This gives a strong understanding on disease dynamics. So here we show the example for disease spreading, the amount of susceptible people getting infected. And for disease spreading, we see that the most important features for the US include school interventions and bar restaurant interventions. And as the static feature, we see the ratio of population above 60. And for Japan, we see mobility change as the most important time series feature, whereas average BMI is the most important static feature. And we can confirm that most of these features are also highly consistent with scientific literature, and our model can find these just by learning from data. I would like to also talk about what-if simulation capability of our framework. And this is highly important for decision makers because they can see the impact of different scenarios into the future before implementing them. So one of the important scenarios to consider is changing the interventions. And here is an example where we have different levels of interventions in Texas, Washington, and South Carolina, 3 different states in the US. And our model can take the impact of interventions into account, and you can see that increasing the interventions basically is helpful in reducing the change in the number of exposed people with amounts depending on the location. And we have also generalized this capability for vaccinations. So as you all know, vaccine management was very important. And our model has the capability of also modeling different amount of vaccination rates. And again, for the 3 locations, we showed what if scenarios with low expected and high vaccination rates. And as we know, increasing the vaccination rates decreases the amount of exposed people, and our model quantifies this differently for different locations. Lastly, we would like to make sure that our model is fair. So we adhere to the AI principle of Google of avoiding creating or reinforcing unfair bias. And we have done extensive fairness analysis on our models, both for the US and Japan. So we have made sure that our model is not creating or reinforcing unfair bias when we consider different sensitive attributes in the population, such as race, income level, gender, and so on. And you can see some example results that we have demonstrated our model's errors are not dependent on any of these. And when we look at different slices of the population, we have seen that our model has yielded very similar performance. Our model has been used by many organizations, both in the US and Japan. And here is just a summary of some of the ones that we have done studies with closely. And our users included organizations from academia, government, private industry, and the use cases included things like resource allocation, business planning, scenario planning, general understanding of disease dynamics, and confirming their existing forecasts with also varying frequencies. Overall, we have demonstrated an AI-augmented COVID-19 modeling framework. And in a pandemic, it's critical to inform decisions with the most accurate, up-to-date information. And we have demonstrated that our framework has the capability of providing very accurate forecasts into the futures for the next few weeks. And beyond accuracy, we have also demonstrated the capability of our framework for explainability and what-if simulations. And these are the capabilities that are very important for decision makers in healthcare and public sector, as well as in different businesses. And throughout our approach, we have demonstrated that accurate forecasts are not only possible, but they are essential and growing part of public health. Thank you, and I would be happy to take your questions.
Thank you so much, Sercan. We have a few questions from the audience. How do you think that this pandemic could help make medical AI better and more trustworthy?
So one of the issues we have observed during this whole project was data quality, both in the US and Japan. And I think this pandemic was the first one that we have started collecting vast amount of data very frequently from many different resources. And I think the infrastructure for it was not there completely, but many organizations have started investing more and more on it throughout the pandemic. And I think that now probably both countries are at a better stage now, and probably other countries are at a very different position. So I believe that investing a lot more in the infrastructure for data quality for healthcare and public sector organizations could be one of the very important takeaways for this pandemic.
Great. Another one is hundreds of predictive tools were developed to help fight the pandemic. However, none of them made a real difference, and some were potentially harmful. What is the reason, in your opinion? And was there a rush to move to use AI models before properly tested, like an issue that always exists in labs?
Yeah, that's a great point. So overall, there was the challenging trade-off of launching things fast and launching things reliable for us. And we had prototypes much earlier than our launch date actually, but we needed to make sure that with some prospective evaluation, they give very high accuracy, or we need to make sure that they satisfy our fairness needs and stuff like that. So I think very extensive diligent testing is required before launching such models, as very important decision makers are using them. And there are a lot of models, as you said, but since most of them are not properly tested, they might not be used and eventually be impactful. So it was one of the things that we put a lot of attention to, that we launch it sufficiently reliably so that it can be used by many organizations for impactful decision making.
Okay, thank you so much, Serkan, for being
Yeah.
with us, sharing this super interesting insights with our audience, and have a great day.
Yeah, likewise.